Good morning. So my name is Ashley. I'm the licensed esthetician and owner of Full Moon Healing Studio in Wilmington, North Carolina, my beautiful beach town where I am born and raised. I'm so excited to be here with you all. I've been an esthetician for 5 years and I've had my studio for 4, and it's been such a beautiful experience. We're going to be utilizing the HydroDiamond machine today. This is Zemits 8-in-1. And then we're also going to be utilizing the new plasma pen. So I know you guys have been seeing this all over Zemits social media. I've been posting about it. A lot of the ambassadors have been posting about it. There's before and afters on my page, on my portfolio, utilizing this. So we're going to talk a little bit more about this as well, and ask me any questions that just come across with any of the machines that we're doing. So we're going to be doing HydroDiamond and Electro-Vibration with the Zemits Verstand HD. If you have the Pro version of this, which is the newer version of this, I'll kind of tell you what the difference is. But if you have the Dermalux Pro, which is the 3-in-1, we're going to be utilizing the HydroDiamond. But if you have questions about or interested in bringing in any of the HydroDiamond machines, this is the webinar for you, because we're going to be talking about certain protocols that you can do and the benefits of each one of these modalities that we're bringing into our treatment today, okay? So we're going to get started. So I purposely do not prep my client before. I like to showcase how I begin a treatment as well. I think that's really important. The beginning is really important. Also, the middle is just, that's the power. And then the ending. So we're going to start off with a really beautiful impression, and then we're going to end with how we want our client to remember our treatment. So I like to showcase how I utilize everything back here. So I always start with aromatherapy, and I get my client acclimated to my touch and my energy. If you guys have taken any of my courses before, you hear me talk a lot about the importance of getting our client acclimated to our energy and our energetic fields, and us with them as well. This is a very intimate experience that we're going to be having with our client. We are not only interacting with their skin and touching their skin, we're interacting with their energy as well. And I have had a few new clients come in and tell me that they are always nervous about getting a facial or massage just because we are touching them. That is so valid, right? If you don't know someone and they're touching you, it can be a little bit nerve-wracking or intimidating. So always get your client acclimated to your touch and your presence and your energy before you get started. So this is just a little bit of a sweet orange oil that I have on my wrist. And we're just gonna have our client really take some big inhalations and exhalations. And then I always start with one hand on the third eye and one hand on the heart center, just letting our client know that they're safe, they're protected. While they're with us, they are in such good hands. And then I will just kind of work my way up onto the skin and getting her used to just my energy and my touch. And I love to do a little bit of pressure in the center. It feels really good and very intentional as well. And then I always feather off. Finding a way to end each step is going to be important. So you're going to see me kind of feather off a lot, but I know practitioners who feather off on the décolleté and the shoulders, whatever works for you, okay? And this is all before we put the headband on. The headband is also an intentional moment. So I use the word intentional a lot because every single step back here needs to be super, super intentional for your clients. And we're going to come in and we're going to start with our double cleanse before we go into our HydroDiamonds. We're going to come in just because of the fall and winter time. This is the vitamin C cream cleanser from Glymed. I love this cleanser, especially this time of year. It's antioxidant, anti-inflammatory support, and just really juicy and creamy for this time of the year. And we're going to start on the neck area and working this cleanser all the way up. And just have some movements that are really fluid and flowy. I change my movements and my massage techniques constantly. I'm always learning new techniques and things that really inspire me that I'll bring into my practice. So you'll do each cleansing step for a couple of minutes, just depending on the time that your client has selected. And then we're gonna feather off. Is there any questions so far about how I begin the treatment or any of the prep that we're going into? Amazing. Now we're gonna go in with a treatment cleanser. So I always say the first cleanse is that sweep, and then we're going to mop, right? So I like to go in with a treatment cleanser, and we're gonna keep it powerful yet really gentle as well. So with that in mind, we're gonna go in with a Mandelic acid cleanser. This is the Idyllic cleanser from Glymed. I love this. This is 3% Mandelic acid. If you guys are not familiar with Mandelic acid is a really gentle alpha hydroxy acid. It's a heavy molecular structure to it. So it's going to penetrate slowly onto the skin, which makes it really, really effective and great for even the most sensitized skin. So we're gonna come in again on that neck area. So this Mandelic acid is antibacterial. It's gonna increase that cellular turnover and do a gentle exfoliation on the skin. Now, when it comes to the skin, we have to exfoliate it, right? That's how we make sure that our skincare is working to the best of its ability. But just choosing the right products for your client is going to be really, really important. So having something that is powerful yet gentle in your back bar is going to be really supportive. So I use Glymed, I use Mixi, and then I also use some Skin Script as well. And right now I'm also playing around with some Lemieux products. I started using them at the Los Angeles Forum recently, and I have some of their samples and I'm really enjoying some of their products. So I'm thinking about bringing in Lemieux into my practice as well. And then again, we're gonna feather off. We do have some warm towels. So within each treatment, if it's a 60, 75, 80 minute, they're gonna get usually about 3 to 4 warm towels, just depending on the time. But I love to use a warm towel after the first cleanse. And just do some firm pressure here. Really allow your client to feel that warmth. Having a bed warmer for your clients, especially this time of year, is really, really supportive. You're gonna have them just feel that warm hug energy and some pressure. And just allow them to feel that warmth from the towel. And then we're gonna remove. And this is always going to be my first step before I go into an exfoliation treatment. We can't build a house without a solid foundation, and clean skin is going to be that solid foundation. So choosing the right cleansers for your client is going to be really important. So we're going to come in with HydroDiamond. Again, I have the 8-in-1 Verstand HD. Whether you have the Verstand HD Pro or the Dermalux Pro, you can start with this. And we're gonna go in with the HydroClear from the Glass Skin collection from Zemits. This is a lactic acid-based serum. Lactic acid base is another gentle exfoliation ingredient, and it's also hydrating as well. So this is the HydroClear solution. Now, this is a little bit goes a long way, guys. Don't waste your product. So you need just a little bit for the entire face. This is a 4-ounce bottle. This has lasted me about 6 months. They also have the bigger bottles as well. So I have my serum prepped. Now we're going to go and select our tip. And for my client, we're going to do the 200 grit HydroDiamond piece. Now there's going to be a little nozzle on the side that you can select your suction. So I always start off kind of halfway, and then you can gauge that how strong it is with your client, whether you need to go up or you need to go down. Something that I love to do and pair with HydroDiamond is an enzyme mask. So you can do an enzyme mask before this to kind of really help to break up those bonds that's holding that dead skin in place. And then you can go with HydroDiamond to really polish it off. If you want that enzyme to penetrate deeper, you can do HydroDiamond and then go in with an enzyme after as well, just depending on what you're trying to do for your clients. If you do chemical peels, HydroDiamond is a great prep before your chemical peel as well. So we're gonna work in sections for my client. So I'm gonna start on the forehead. And the reason why I work in sections is because, especially with us doing a deep cleanse, if I put this serum all over, her skin is going to drink it up and then I'm gonna have to reapply. So I work section at a time. That way we're not having to reapply and wasting our product, right? So we have to think in the business mindset as well. Save our product, and that's just gonna help us on the business end. And working in sections is super beneficial for me, and that's just keeping this 4-ounce bottle lasting for as long as it is. So we're gonna turn that on. I check the suction. And then make sure that you're pulling that skin taut. And then I always start on the T-zone just to kind of see how that suction is and then that pressure is. And then check in with your client. How's that feeling? Good. And anytime you're using actives on your client's skin, Mandelic, glycolic, lactic, salicylic, always check in with your client. And I kind of have her help me gauge what it is that she's feeling. So, because if I put a lactic acid solution on her skin, and I know that that's supposed to be very minimal activity, but she's telling me like I'm at a 4, 5, 6, then we know that there's something going on with that skin barrier, right? So then we need to pause and we need to pivot. Do you feel any activity on the skin? Okay, perfect. So she feels nothing, which is amazing. And remember, we have to know how to pivot, because if there's something going on with the skin barrier, we have to heal. I'm gonna turn you this way. We have to heal that barrier before we do anything else. So all of my back bar, everything that I have is super easily accessible. I've got back bar here and I've got back bar here. I want to be able to grab everything very easily and very quickly if I need to, because we can have an idea of what we think our client needs, but you never know back here. So having all of your back bar easily accessible, that way you can pivot when you need to pivot. So again, we're working on sections, and I just slowly tilted her this way, and then we're going to work our way up. I always include the neck in my protocols. I know some people will do that as an add-on. Whatever works best for your business. Because the price point of this is so low for me, I just go ahead and include that. I think it's going to benefit our clients, and it's going to keep our clients coming back for more. That way we're not just working on the face, we're really covering the neck and the face as well, because as we know, the neck can really start to age first. So always include that in the neck if that works for your business model. If we are doing anything with the décolleté, I will go ahead and do that as an extended price. But chemical peels, micro needling, anything like this, I will go ahead and include that in my price point. That's just allotted in there already. I've been asked a couple of times, how many passes would you do? That depends on your client. So if I'm pairing this with an enzyme, I will just do kind of one pass on everything. But if you don't, and you just do this as just a HydroDiamond treatment, you can do this and then go back and do it again. So I'm going to turn you this way, but just for the sake of the webinar, we're just going to do one pass. How are we doing? Any questions? Okay. So this is our prep, because then we're going to go into our plasma treatment, and we're going to talk more about that. So we also have acrylic tips for this as well. So the grits for the HydroDiamond part, we're going to have 200, 150, and 100. The higher the number, the gentler that exfoliation diamond tip is going to be. So first time clients, I will use usually about a 200. But if they've been to me and their skin is really nice and prepped, their skin barrier is so strong, then we'll definitely go in with that 150. I always usually start new clients again with the HydroClear, because that lactic acid It's all about slow and steady winning the race. We don't need to cram all of these harsh ingredients onto our client's skin right away. So first treatments with me, I'll probably start with a 200 and a lactic acid and a gentle enzyme. And then their next treatment, I can go a 150 tip. And then they have the glycolic and vitamin C. It's called the Glyco Velvet. That is one of my favorite ones that I use. So I can probably up their enzyme and then go in with a glycolic and vitamin C solution. There's also a salicylic. So something that you can do for your clients, I'm gonna turn you straight, perfect, is you can put the salicylic on the nose or any of that congestive area first. Let that BHA really do its job, do the whole face, and then you can go in, add just a little bit more serum, and then go in with your extractor tip, and that's gonna help to really pull out anything that's in that T-zone or any of that area that's congested. So we're gonna end on our nose area with the first part of this, our HydroDiamond. And anytime you're using actives, you can have a little bit of erythema on the skin. That is very, very normal. Just having things into your back bar that's gonna be able to calm that skin down and rehydrate and balance everything out. So we're finishing up with our HydroDiamond. Now we're gonna go into our plasma treatment. This is super exciting. I've had this about 2 months now. I have an acne program in my treatment room. It's included with all of my acne program clients. And if I'm doing an electro-vibration treatment, I love to pair this. This is something that every single client can benefit from. It's antibacterial. It's going to send oxygen-rich blood to the skin. It's going to help with collagen production. It does so many different things, but at the cellular level. So something we get asked a lot is, what's the difference between high frequency and plasma? High frequency is going to work on the surface. Plasma gets down to the cellular level. So it gets down super, super deep. So that's why my acne clients are really benefiting from this, because we're getting all of that bacteria and we're killing it almost instantly. This is also going to open up the channels of the skin for up to 12 hours. So clients that I'm working with pigmentation, and I have them on pigment inhibiting serums, I'll do their treatment, I'll do their plasma treatment. Their skin is going to be really open, especially after this treatment as well. Then they can go home and use their tyrosinase inhibiting serums, and it's going to be able to penetrate deep as possible into the skin. I microneedle back here. All of my microneedling clients, this is included. I will do this as a prep to make sure we kill all the bacteria prior to microneedling, and then I will sandwich this on top as well to help to speed up the healing and recovery process of this, because it's amazing for inflammation. And then it's also going to make sure we're killing all the bacteria. I have some rosacea clients. This is including, it's really amazing for calming that inflammation onto the skin as well. So you name it, your client can really benefit from this. So before you do plasma, just make sure their skin is nice and dry. How's your skin feeling? Any tingling activity? Okay, perfect. So this is going to have a few different modes to it. So you're going to have continued, and then you're going to have the pulse. If you have a new client, I will usually start with the pulse just to kind of get them used to it, but the continued is going to be a little bit stronger. So we're just going to go level 1 continued for this client, but help your client understand and gauge it. So this should not be painful at all. It can just be almost like annoying. It just feels like little scratches on the skin, but it is really beneficial. So we're going to start again working in sections. You can kind of hear it, and then we're going to put it here that we can kind of just see. And you're going to really smell it. So it's going to take the oxygen and turn it into an ionized gas. So I like to say that this is oxygen with superpowers. So we're going to come in, again, we're going to work on the forehead. Is there any questions about plasma before we get started, or just as I'm going through this? You can ask me any questions as well. How's that? So antibacterial. It's going to be amazing for inflammation on the skin. So acne clients, it's a must. So now I have clients who will do a plasma just treatment. So if they have breakouts, if they have an event and they need these breakouts gone very quickly, you can go in with a plasma treatment. So I'll go in with an extraction and then I'll go in with plasma. And within 24 to 48 hours, that breakout is almost completely gone. So especially when we're talking about cystic acne, you know cystic acne is really painful and it can take a little bit for it to go away. You can go in with plasma and you're gonna notice it really going down in about 24 to 48 hours. So again, working in sections, just lift your chin a little bit for me, perfect. And we're gonna start down here and it's letting them know that you're about to come in with this because it does do that little bit of a shock. So getting your client used to that. And this is gonna be continuous. So they're gonna have it the whole way. And this is a very quick treatment, 3 to 5 minutes for the entire treatment. So this is gonna open up the channels of the skin. That way when we go in with our electro-vibration treatment, that serum that we've chosen is also gonna benefit and go deeper into the skin. Now this is sending oxygen-rich blood to the surface as well, to the skin. So they can have that little bit of increase in erythema right at first because we're sending that oxygen-rich blood. Very, very normal. And depending on, if you have a rosacea client, keep it at level 1, no more than level 2. If you have a client who has acne and we're really trying to get it taken care of, you can up that. And spot treat as well, but definitely do all over. And we're gonna hit that neck area. So if your client has actives in their routine that we really want to increase the benefits, but I'm definitely noticing it if I have a client with melasma, pigmentation, and they're on those pigment inhibiting serums. After this treatment, they can go home, they'll use their serums, and their skin is really able to drink that up on a deeper level because we're opening up those channels for up to 12 hours. So we're gonna go this way, perfect. So I use this before chemical peels, and then I sandwich it with microneedling. Before microneedling to kill all the bacteria, and then after microneedling to make sure all that bacteria is again off the skin. And more here. And that we're gonna speed up the healing process as well. I've posted on my Instagram, there is a case on there that I did the sandwich method, because as we know with microneedling, they can be red for 24, 48 hours. I did plasma right after, and after 3 hours, her erythema was almost completely gone. Now, with that being said, we're not taking away what we're trying to do with microneedling. We're just speeding up that healing process. So your client is going to have a little bit less downtime in their experience with microneedling. Now, just be mindful when we are doing chemical peels. I'm going to do your nose. Okay. That if we are doing a TCA peel, a higher grade TCA peel, this is opening up the channels of the skin. So be mindful of what chemical peel that you put on top of this, because it is going to go deeper. Can you ask her how it feels? They want to know how it feels.
It really just feels like a scratching, but very light.
She said it feels like a scratching, but like very light. And that's exactly how I'll describe it. It feels like tiny, just like scratch needles. It's like very, very quickly. And again, it should not be painful at all. It's just annoying, right? Just a little scratching onto the skin. All right, I'm gonna have you tuck your top lip. I'm gonna do it quickly. The top lip can be a little bit more sensitive because it's the top lip. We do it wax, we all know it's a little bit painful. So we're gonna do it quickly right here. And perfect. So I'm gonna turn this light off. She's all done, so maybe you guys can see. And I'm gonna crank this up to the highest setting, so hopefully you guys can see what it is on my hand. So the higher that it is, the more intense it is. So always start off really low with your clients. You can always start off on the pulse setting, and that is going to be just gentle pulses. So you can always ease them into that. It is going to be stronger when you have it on that continued, but you can always start your client off with the pulse. So again, you can work this into every single treatment, especially if you are trying to pick these ingredients and you're doing modalities like Electro-Vibration, where we're trying to really get these serums as deep as possible into the skin. It is amazing. You can look at my portfolio of befores and afters that I did with HydroDiamond, plasma, and Electro-Vibration. I have some before and afters with my acne clients on there. You name it, you can utilize it. I also have a before and after with one of my rosacea clients, and we did 3 treatments, and you can notice the before and afters, the decrease in her erythema. Are you actually touching the skin with the guard? Yes. So this is going to be dragging. You can kind of spot, or you can do all over like that. So as far as disinfecting, this part is not touching the skin. So you're going to be disinfecting, and you can take your cavi wipe all of this and wipe this. So this is actually going to be touching the skin. But again, the higher that it is, the stronger that ionized gas is really going to come out of the plasma pen. So if you are trying to level up your practice, especially if you are trying to get into the market of working with more acne clients, more inflammation in your treatment room, if you are trying to have something that is going to help you with pigmentation and helping to decrease that faster, this is absolutely changed the game. I've had this for about 2 months now, and how quickly I'm able to now work with my acne clients and clear their skin, calm inflammation. And now that I'm utilizing this in the sandwich method with microneedling, it has been so beneficial. Also, I have cryotherapy back here as well. So ending with cryotherapy is amazing. The Verstand is going to have the cold skin that you can do. And then I also just have the true cryo machine from Zemits as well. So we've done her plasma. So her skin is ready to receive the Electro-Vibration treatment, okay? So this is a powerful treatment that you can get done in 60 minutes. So if you are trying to make a difference in your client's skin quickly, this protocol. Okay, so the difference is I have the Verstand HD. This one with the meso, your client is going to be holding the grounding bars. If you have the new Pro, that one is now you don't need the grounding bars because there's actually a grounding piece there, which is awesome because you can kind of just pick it up and go. So your client's going to hold the grounding bars. Perfect. And they can just be light. Yep, perfect. And we're going to switch our. And so this is our mesotherapy, our Electro-Vibration piece. And I have put in here a little bit of a peptide serum. So peptides is going to be helping to hydrate and plump up that skin. So her skin is going to be really hydrated, plump, and dewy. This particular protocol I've done for a couple of brides to be because they want a powerful treatment with no downtime. This is it, okay? So I always like to mist my client's skin before putting on any type of serum. The reason being is our skin is porous like a sponge, right? If we put a serum on a dry sponge, we're going to be here all day waiting for it to penetrate. But if you can dampen the skin, rehydrate the skin, the mist is going to help to grab the molecular structure of this serum and pull it deeper into the skin because we're kind of dampening that area. So it's going to help that serum that we put into this meso dive deeper, okay? So we're going to come in and we're going to quickly mist her, just letting her know that we're coming in. 1, 2, 3. And it's my client's birthday, so we have to give her a really awesome treatment, okay? So there's 3 modes. There's A, B, and C. So with this, I always start my client low on A, and in each A, B, and C, it goes up to, I think, 15 or 20 strength. Always start your client low, and then you can work your way up. It can feel like a little bit like a TENS unit. It's a very weird sensation, almost like hard to put into words. It's not uncomfortable. It's not painful. The higher that you go with this, they can have that little bit of like twitching in the face because we are working out the muscles as well. So this is amazing for strengthening the elasticity of the skin along with deep serum penetration, okay? So again, we're gonna start on the forehead area. We're gonna start her on mode A. And then I'm gonna start her just on 5, just to see how everything feels, okay? And I'm gonna get the serum ready. Okay, perfect. I'm gonna start here, you let me know how this feels, okay? How's that? Was it weird?
Yeah.
Is it painful?
No.
Not painful, just weird.
Interesting.
Someone said happy birthday. It's their son's birthday as well. Now, do you think you can go higher or do you like it how it is?
I think I can go higher.
Higher? Okay. And when you go higher, how's that?
It just feels funny.
It just feels funny. It's really hard to describe what this feels like. It's its own personal sensation. The forehead area is going to be more sensitive than the cheek area, right? How's that? Is it still okay? Okay. And what this is doing is taking this peptide serum and it's pushing it as deep as possible into the skin. And so with us going in with plasma first, we are really getting this serum deep. And that's the name of the game when we're having a treatment, is how deeply we can make these serums penetrate and how much of a difference can we make in our client's skin in a short period of time without having that downtime. So this is a great treatment. You can do that. She said,
I might feel it in my tooth.
yes, you will. It is sensitivity on the teeth area. I have little metal wires inside of my teeth from having braces years and years ago. But even if you don't, you can still feel it in your teeth area when you get there. Is this too much? Are you still good?
No, it's good.
So she's still doing okay. It's just, it's funny because it's its own personal sensation. And the stronger that you have it. So right now we are on mode A. And we are on level 8. So this is perfect for her. I have clients, and every client is going to be different. I have clients who are all the way up on C, and they are vibing. So every client is going to be different. Listen to your client. No two client is going to be the same with how this is going to work for them, okay? And so she's got a little bit of twitching happening underneath her eye area. And so a question I get asked a lot as well, what can you put in this? So this can be your own personal concoction of whatever you decide to do. This is the Zemits peptide serum that I've put in here for her. If you have your own favorite serums that you want to dive deep, please use those, okay? The reason why I love Zemits, and when you talk to different ambassadors, we all use different skincare. We all use different protocols. That is the beauty of these devices. You can create your own treatments and your own protocols with whatever skincare and back bar that you know and you love, okay? There is no wrong answer. This is how I'm doing it, but how someone else doing it is how they want to do it, okay? So you can take your own serums and you can work this in here. Can you use this with acne clients? Absolutely. There is an acne serum that Zemits has. It's called Acnolex. If you are trying to really decongest the skin or work on a deeper level with these serums for your acne client, put a acne serum into this meso as well. And I use the Zemits, but you can use whatever acne serum that you know and love. What do I charge for this serum, for this service? So my treatments are all based on time. When I first opened, I had a bunch of different facial names that were really cool names, and a bunch of different add-ons, right? That can be really overwhelming for your clients. So over time, I have started doing it's just fully customized, because even if they were choosing one particular treatment, I was coming back here and I was pivoting because it probably wasn't supported. So now my clients are going to select 60, 75, or 90 minutes. They select the time. I select the treatment, right? We're here, we're showing up to learn and grow. We know what is going to be best for their skin. Their skin is going to tell us everything it needs. So my 60 minutes, and again, I'm on Wilmington, North Carolina. This is my price point. You kind of look at what's in your surrounding areas. 60 minutes is going to be $160. 75 is $200, and then my 90 is $240. Now with that, they can get a plethora of different things. I have oxygen dome therapy, I have cryo, I have Verstand 8-in-1. You name it, they can probably get it. Now when it comes to plasma will be an add-on just because it is a powerhouse of a treatment, okay? So my microneedling, for example, is $290 for a singular treatment. If they do microneedling with plasma, which is what 90% of my microneedling clients are doing now, it is $375 for a plasma add-on. And that is because not only are they going to get a treatment, so my treatments for what we're doing right now is also going to include hand, arm, shoulder, facial massage. I include oxygen dome therapy in every single treatment. I include LED light in every single treatment. Depending on the time and what I think is best, it depends on how many modalities we are going to use back here, okay? So 160 to 240 on a regular customized treatment, and then either 290 or 375 for a microneedling if we're including plasma. Now, if they are in my acne program, I go ahead and do the plasma in that price because it is changing the trajectory of how I do acne treatments now. It is amazing. Like, I will not take an acne client and not use plasma because of what I have actually seen this piece of equipment do for my clients, okay? So we have done her meso treatment. Then we'll take your grounding bars. Beautiful. Now you can come in and we're going to, let's throw in a little bit of cryo. Let's get crazy back here. So if you don't have the ColdRestore cryo machine, you can do the cold wand that's on the Verstand HD, the Dermalux, the Pro. I'm going to use our cryo. The difference is how cold this gets. This is a true cryo machine. So this is going to get very, very cold, icy cold. It actually ices at the top, it gets so cold. If this one, our cold wand here, is gonna get cold, obviously not as cold because that's a true cryo machine, okay? When I do cryo, I always end with cryotherapy because I call it like icing on the cake. It's going to really dive our finishing products deeper into the skin, really cool the skin down, especially when we're doing some more advanced things for your client. So we're quickly going to put some finishing products on her. I'm going to mist you one more time, okay? Going back in with that skin mist. And we're going to come in with the Fulvic Elixir from Glymed Plus. I call this my no bad vibe serum. It's antioxidant, it's anti-inflammatory, it's antibacterial. So it's an amazing just ending serum that you can layer on top of what we have just done. How does your skin feel? Perfect. Any sensitivity, irritation, activity. Perfect. So then we're going to layer our moisturizer on top, and we're going to come in with a recovery cream from Glymed. This is an arnica cream. I love to kind of end our treatments back here with this. Now within this treatment, when I'm doing like a regular facial, again, hand, arm, shoulder, facial massage. I've had a few DMs about how to kind of incorporate all of that into a treatment and time-wise. So in a regular treatment, they're going to have a deep cleanse. I'll probably put an enzyme on them. While that enzyme is sitting, I'm going to do hand, arm, and shoulder massage. After that, you can go in with your HydroDiamond to really polish everything off. And then you can go in with your facial massage, any other modalities or things that you want to do. You can do the facial mask that you mix up. And then I will go in with mesotherapy. That is towards the end of it because that is serum infusion. So I want to get that serum in there, and then I'll layer all my finishing products on top of that as well. So facial massage is towards the end of it. Oh, Angelique, are you from I just saw your above message. Were you at the LA forum? Were you the one that I talked to? I believe so. All right, so her finishing products are on. Now we are going to do cryotherapy, and we're going to end this with such a bang. So this is the Firming Genius. This is our peptide gel. It's going to have collagen and aloe in it as well. So it's chef's kiss. It's great to end this treatment. So again, I'm going to work in sections. Typically, I start on the forehead. With cryo, I start on the end because this is a cold treatment, and you want to get your client acclimated to what it is that we are doing, okay? So I'm going to take our gel, and we are just going to put this right on top. Perfect. And something that you can do as well that we will do really quickly for her, since this is a cold treatment. Hi, doll. What two machines do you have? So I have Verstand HD, which is what we did our mesotherapy, our Electro-Vibration, and our HydroDiamond. That's the 8-in-1. This is cryotherapy. This is the ColdRestore. I also have my oxygen dome, and I have the LED. I have the EvoPlasm. I have a lot of Zemits devices because they are absolutely phenomenal, and I'm currently running out of room, or I'll probably get more, but this company has elevated my practice like substantially. So this is a warm towel. I'm gonna have you lift your neck for me. Amazing. So we're gonna put a warm towel underneath her neck just to bring that icy hot kind of effect into our treatment. So I don't know if you guys can see. I get this closer. So this is ice over. So it's going to be very cold. Now, when we are working with cryotherapy, the faster that you go, the warmer that it's going to get. Why? It's coming in contact with our skin's natural temperature. So if you want it to remain cold, go slow. So if we move fast, it's going to warm up. You're going to see this dial go because our skin temperature is warm and hot, right? If you want this to remain cold, work slowly so that it can stay this temperature. Same thing when you are working with the cold wand and the Verstand, the Dermalux, anything like that, okay? So we're going to come back in with our gel, and I just put a little bit on to the wand as well. Right now we are at -8 degrees Celsius, so we're pretty cold, which is why I start on the bottom and work our way up just to get your client used to the cold. So this may be cold, it's going to warm up a little bit, okay? Just the cold, let me know. You can control this as well. There's gentle, moderate, and strong as far as how cold it gets. Coming in. So acne clients, this is amazing for. If you have a client with inflammation, impaired skin barrier, this is phenomenal. So I'm working a little bit quicker just for time wise, but typically in a treatment with time, you kind of just want to go slow and slow and slow and take your time. So if you truly want this to remain cold, enough time within your treatment to perform this. So usually about 15 minutes to do this whole treatment. I'm going to come and just work in sections. Is there any other questions? So I put my finishing products on first, and then we are pushing this right on top. This is really going to help those finishing products dive deeper into the skin. This is amazing for depuffing the skin as well. So if you're working on the under eye area, you can really go underneath that under eye area as well.
I was just about to ask that.
Yeah, the under eye area, yep. Because we always tell our clients, especially, like, go home and ice your skin. Ice don't pop. So we have taken that and we've put it into a machine at a really, really cold temperature, okay? This also has a body piece. So if you do back facials, body treatments, anything like that, you can use the body piece. You can also use that body piece if you're working on that décolleté area. But we're doing full face. And this is easy to disinfect. I take my cavi wipes and I wipe this down. I wipe the whole machine down, my bottle, everything. So really easy to disinfect right after a client, okay? So now we're gonna come on to the other side and just letting your client know that you're coming in so that it's not as jarring for them, okay? And work right in that lymphatic area as well. And then just work my way up. The faster you go, the warmer this gets. If you stay nice and slow, it's really gonna remain cold for you. And if you don't have any of these machines, if you don't have the Cold Restore, finish your treatment with a warm towel underneath her neck like I have, and go in with ice globes or cold rollers, something like that. I love to do a warm towel underneath that neck area, and I'll do that in a couple different areas of my treatment. Same thing, 3 to 4 to 5 warm towels, just depending on the time that my client has chosen, okay? Now we're gonna end with the forehead area because now she's acclimated to the cold. She knows what it's gonna feel like, and so it's not gonna be as jarring for her if I'm starting at the forehead area. So just get this worked in. And there is some estheticians who will actually use this gel as a mask. You can absolutely do that. So I kind of leave it there so it's acting as a mask as I'm doing the rest of this treatment. So we're gonna start and kind of work your way in. And then slowly, again, the slower, the colder. But for just sake of time, but this is still really cold. We're at 5 degrees Celsius, so it's still really nice and cold for her. And after this, we're just gonna remove this excess of the gel. I love to do a little bit of a facial oil, especially in the fall and the winter time. It's really cold, and that cold weather can really pull out our moisture. So I just really make sure I'm loading my client up with the proper hydration ingredients and the proper moisture ingredients after a treatment, since we've done a deep cleanse and exfoliation. That's where we're gonna end. And then you'll just disinfect all of this at the end of your treatment, and then we're gonna wipe off the excess. And then I'm gonna show you guys how I like to end my treatments as well. Remember, the beginning of your treatment is really important. You can have a bomb middle, right? But if your ending especially is not good, they're going to remember that. So start off with an amazing impression and end with an amazing impression for your client, okay? So we're gonna come in and just layer her up. We're gonna do a little bit of a facial oil. This is just a jojoba oil. I call this just like my universal oil. It's non-comedogenic. It's great for most of my clients. And right now her skin just feels like velvet. It feels amazing. We have a little bit of erythema in the cheeks. That is really normal when we did a little bit of a lactic acid and we did that plasma. You'll notice that going down in about an hour post-treatment. So we're going to go in with a little bit of our sunscreen. We're just going to use an SPF 30 and layer that right on top. So we are going to be doing, we have launched all of our February webinars. I think I'm doing 4. And I know that in one of my webinars, stay tuned, we are going to be doing a giveaway. The giveaway is going to be in February, so just stay tuned on my Instagram and I'll be announcing exactly when that webinar will be. And the giveaway is you are actually going to win a one-on-one call with me. So we will schedule a call, and it's a one-on-one personal call, and you'll get to ask me any and all questions, whether that has to do with Zemits, business, social media, you name it. We're gonna have a personal one-on-one call, so stay tuned for that. We're just gonna go in with a lip treatment. This is Glymed's lip treatment. If you know, you know. It's one of the best on the market. And now let's end our client with a really powerful affirmation and ending. So we're gonna remove our headband. And I'm just gonna pop this out. Perfect. Now we're gonna come back in with our essential oil. Now this is what works for me. So create an ending that is in alignment with your practice, that's in alignment with who you are, everything. So we're gonna come back in with a little bit of an oil. All right, now again, I'm going to end how I started. So I like to close my eyes and then have you take a big inhale through the nose, hold it at the top, 2, 3, 4, exhale. Now before we take our final inhalations, really set your intentions for the rest of the day, the rest of your birthday, and into the weekend. Hold that and inhale through the nose, hold it at the top, 2, 3, 4, let it go. Shoo. Thank you so much for trusting me with your beautiful skin and your energy, and you are all done. So really set a powerful ending. Have your affirmations, whatever works for you. I've done so much traveling. I spent a month in Thailand, so my entire practice, it comes from my travels over different places that I've been to. I get a bunch of massages, I get a bunch of facials when I travel. So I take what works for me, what feels in alignment, and I bring it into my practice. Bye guys.